Hello, and welcome to day 2 of Writing Week. And today's session is focusing specifically on medicine. So, welcome to all of the doctors joining for today's session. We're looking forward to sharing the medicine case notes and talking through the strategies you should use to get ready for OET writing. So all week we have dedicated live sessions for each of the 12 OET professions. If today's session doesn't match your profession, check out the dates that are on the screen now. And you can see that we're offering sessions tomorrow for nursing. On Thursday, we have a session for dentists, optometrists, and vets. And on Friday, we have a session for physiotherapists, occupational therapists, and speech pathologists. So you're very welcome to stay today, of course, and there will be tips that I share which could be applied to your profession too. But also feel free to come back on another day which is for your specific profession. So hello to everybody joining on Facebook and YouTube. It's great to see so many of you this morning. We've just tipped over 100 candidates joining live, and we've got around 60 people joining us on Facebook and 40 on YouTube. So it's great to see those numbers joining in for today's session. The idea for these sessions is that they're going to be interactive. I want to see your opinions and read your comments as we go along. So please make use of the comment box, as some of you are doing at the moment, to say hi, using your social media channels. But also I'm going to get you to regularly vote in some poll questions. And we're going to practice using this feature now. If you have a second device handy, you might want to use that. Or if you're using a laptop or computer, open a new tab on your current browser so you can easily move between the live stream and the polling software, which is menti.com. So we're posting a link into the comments now, which is for our first poll question. And I'll pop that up on the screen as well. And the question is, have you written a letter for the new set of OET case notes? So this could be for any profession. We've got the case notes out there for all the professions so far. Let me know in the poll or in the chat on social media whether you have written a letter for the new set of case notes. So I can see lots of people answering the question at the moment. Just about more saying yes to no right now, but fairly evenly split. Some of you obviously have made use of those case notes. Some of you might be waiting to see some of the explanation that comes with this session before you have a go yourself, which is absolutely fine. All right, the second question I'm going to ask you, and we'll post the link again to that in the chat now, is when are you taking OET? So type your test date into the link that's in the chat, or let me know in the comments. What is the date of your OET test? So I can see we've got somebody taking the test very soon, the 9th of October. We've also got early November. Quite a few of you taking it in early October. That's great to see. Somebody here who's planning much further ahead into February. So that's great to be getting first information at this point and to be working away for a future date. That's great. A few of you are saying, yeah, I'm not ready yet, or I'm going to wait until after I graduate. So this is about information finding, I guess, at the moment. In the chat, I can see also some taking in October, early November, somebody in December. So that's great. We've got a variety of people with a variety of test dates. And the last question that we're going to ask for now, we're posting the comments, which country do you live in? So the link's in the comment now, and you can also see the poll updating on the screen. So let me know which country you live in. I'm talking to you from Australia. Where are you? And it's going to create this nice little word cloud of the places in the world where we've got people joining us from. So USA, Kuwait, Turkey, Spain, Palestine, England, Canada, Sri Lanka, UAE. Great to see all of you here, Kuwait, and in the chat, the Philippines, Romania, India, Somalia, Libya, Egypt, Algeria. That's great to see. Ireland, Tunisia, Japan. It's great to see so many countries represented. It shows how global OET has become, and it's really good to have all of you joining today. Thank you if you've stayed up late for this session or got up very early, one way or the other. It's really good to have so many of you here today. And if you're unable to stay for the whole of the live session, which is going to be roughly an hour, you will be able to see this as a video later on social media. So now we've got used to this software, let's get started with Writing Week. So we're posting a link to the case notes, and we just talked about those in the poll. If you registered in advance of this session, you'll already have received your copy of the case notes, but we're putting a link into the chat now as well that you can download those case notes. Some of you will have submitted your letter for the case notes, and I'm going to be looking at about 10 of those letters today during the session to demonstrate to you what the assessors are looking for in your writing. But if you haven't had a chance to look at the case notes yet, or if medicine isn't your profession, but you're finding out some more about OET or wanting to hear the tips that might apply to your profession as well, we're going to go through the case notes now together, and I will pick out the key information the reader needs you to communicate. So download the version if you'd like, using the link we've just put into the chat. They might be a little bit small for you to read on your screen, so if you can download a copy to have a look at on a separate device or tab, that's likely to be quite helpful. All right, so looking at the case notes, and this applies to any profession. This is the sort of strategy I would apply for doing any writing task. First of all, the things you need to understand are the information about this patient. And all of these details are at the beginning of the case notes. And they tell us that your role as the writer is as the patient's doctor of 2 years. And this patient has a history of cardiac problems, including recent hospitalization. And we can see the patient's name, Eleanor Bennett, and her title, which is Ms., and her date of birth and age, all at the beginning of the case notes. Now, next, we need to understand who we are writing to and why. And I'm going to ask you to look at this information, which is in the writing task at the end of the case notes. And then I'm going to set you another poll question. So the poll question's coming up. You can click on it in the chat now. And also answer this question: how many reasons for writing can you see in the writing task? So have a look at the writing task, which is highlighted on your screen, and then go to the poll question using the link in the chat and let me know how many reasons for writing you can see. Can you see 1, 2, 3, or 4? So let's see what you think. We'll wait for some answers to come in. All right, so we've got somebody gone out in front with 2 reasons for writing. What do you think? How many reasons for writing can you see in the writing task? Somebody else has said 3, 1. That's great. Ali in chat is saying there's 5 reasons for writing. Mohammed saying 3 in chat. And on the screen, we can see we've now got every answer covered. So there's a bit of difference of opinion here between how many reasons different people can see. And in a second, I'll just give you 10 more seconds to put your answer into the poll or in chat. And then I'll let you know the answer. We've got in chat as well someone saying 2. 2 is coming out slightly ahead of all of the others. So that's great. Thank you for answering the question. So in this particular set of case notes, the correct answer is 2 specific reasons for writing, and these are to request advice and review the medication. For context, you'll see you also need to outline the patient's history and treatment so far, but this itself isn't a reason for writing. The 2 reasons for writing is that you want to request advice and review the medication from the reader, which is a rheumatologist. So as you can see on the screen, the tip here is it's really important to take some time to check that you understand that reason for writing. It's so important to get that right for the start of your letter. It's also a good idea to check the last set of case notes to see if there's any additional detail provided about the reason for writing. So look on the screen now and look at the line with the heading Plan. And then type into the chat in Facebook or YouTube any additional detail you feel is relevant to the reason for writing from that line of case notes. So let me know in the chat. You might need to enlarge it on your screen, or if possible, scroll up a little bit higher in the chat and download the case notes. Or perhaps we can post the link to the case notes again in the chat. And if you can't see them clearly, download a copy and then you can have it much larger on your screen. But let me know, looking at that section of plan, can you tell me, is there anything additional that is useful to the reason for writing from that line? Perhaps you've looked at this task before in preparation for the session. What information did you find that was useful from that line of the case notes? Yeah, that's great. So I can see some of you coming through on the chat. Suleiman, Chandan, and Zainab are saying encouraging lifestyle changes. The lifestyle changes is the important part. Mohammed saying that as well. And that's absolutely right. So the ways to encourage lifestyle changes matches up with the request for advice in the writing task. So it gives us a little bit extra information. And that's why it's really interesting and useful to check that last section of case notes to make sure there's any additional relevant information before you go back and start reading the rest of the task. So let's have a look at the next section of case notes. So let's look at the section above, which is the presenting complaint. And I note that this is the same date as the one I've been given to write the letter. So essentially this is today. And again, I'm going to ask you to tell me the answer to this question. We're posting the link to the question in the chat now. From these 3 lines of case notes, how would you summarize the situation in 1 sentence? So I'm going to ask you to write out your own summary, just a 1-sentence summary. Have a look at those case notes either on your own copy or from the screen, and add the summary that you think explains those 3 case notes, what's happened today, into the poll. So how would you summarize the situation today in 1 sentence? I'll just give you a minute to think about that and add your ideas. So from the section of case notes, which are about the 15th of May, how would you summarize those 3 lines of case notes into 1 sentence? I'll give you 30 more seconds just to see if anyone can have a go at summarizing the situation. Type into chat in Facebook or YouTube if you can't access the poll. All right, that's great. Someone said patient has problems from using captopril. Non-adherent patient is another suggestion. The patient requests discontinue of captopril because of the side effects and the stress it causes. That looks a good summary. Well done. We've got a bit of a longer summary of that case notes. Well done for typing those in. The patient reported several side effects of her medication. And in the chats, we've got a few suggestions. Lee says the patient refers for symptoms secondary to captopril use, request discontinuation of the medication. The patient presented complaining of the side effects. That's from a couple of you. That's great. The patient requested to discontinue captopril due to side effects. Great. So I think altogether, we've come up with a good summary. Patient has side effects from captopril being the main part. So well done for working that out. And exactly, I would agree with you. The main summary of that situation is that the captopril is causing side effects, and the patient is coming in to request discontinuation because of those side effects. It's increasing the stress. So the captopril is causing side effects, which is increasing the patient's stress, so she wants to stop. And it's a really good tip to make sure you are understanding the case notes in your own words. So doing exactly that exercise that we've just done there, looking at a section of case notes, and in your mind, because in the reading time you're not able to make any notes, in your mind creating a summary, what's happened in that section of case notes. And that's exactly what you all did, so that's great to see. So going back to the start of the case notes, we need to understand the background of the case from a social and family perspective. So have a look at these two sections in detail, the social background and the family history. You'll notice a lot of it is relevant, but type into the chat box in Facebook or YouTube if you can see anything that you think could be omitted. So look at those two sections of social background and family history, and I'll just give you a minute to have a look at those, and then type into the chat on Facebook or YouTube anything that you think could be omitted from those two sections of the case notes. There's quite a lot of information that you would need to mention, but based on the writing task that we've just looked at, which is to write to a rheumatologist for a medication review and advice, is there anything from those two sections of the case notes that could be omitted that isn't particularly relevant to today's situation? I'll just give you 30 more seconds to see if you can identify anything that can be omitted. So Rabia is coming through on chat saying the older brother's health. Kishka, the divorced line. Zainab, also the older brother's mental health. Yep, quite a few of you are saying the older brother's mental health. The divorced mention. Yeah, great. So thanks for chatting that through. KT saying perhaps being a lawyer, about the children or overweight. Ali saying the travel. Rabia, her job and the custody issue could just be summarized as family issues. Great. Vivi is saying divorced and about her daughters. Excellent. You're all picking out those details that I was hoping you would. So the detail of the family situation, it is important that it's causing stress, but we don't need to give the reader the specific details of the custody and the concerns regarding the children's father. The brother's history at face value definitely seems less significant because it's not heart related. But given the stress levels the patient has, the suicide attempts do become more significant. So it is a bit of a balance there with mental health, obviously. In some situations, where it's not related to the medical condition, absolutely you would leave it out. But because of the sort of severe stress that the patient is under at the moment and the fact that there is a suicide link in the family, it's perhaps worth just mentioning very briefly to the reader. They can make their own judgment on it if you've included it. All right, so let's have a think about the medical history. So I'm going to ask you another poll question now. Keep you on your toes, make sure you're actively involved, and you can see that poll question coming through in the chat now. This one is looking at the medical history. Which of these details would you include in your letter? And you can see I've summarized them into 3 options for you. So the first option is to include the heart attack at the airport, the use of the defibrillator, that there was an emergency admission, and that a stent was applied via the groin, not the arm. The second option is heart attack after a long flight, emergency admission and stent via the groin. Or the third option is emergency admission following the heart attack, 4 weeks off work, gradual return, mother moved in, which increased her stress. So there's quite a lot to read in that question. I'll give you a minute to answer. Which of those 3 options do you think would be the best in terms of what to include from the patient's medical history? You can see we've got most going for the middle option at the moment. But the dots are filling up for all of the different options. On the chats, we've got a few people going for the third option. I'm just going to give 10 more seconds if you want to answer that question, either in the poll or on chat. On chats, we're getting the third or the second option. One person's also come through with the first option. All right, that's great. So overall, the second option was slightly ahead of the first option, not many picking the third option. And yes, I would agree that the second option covers the most important details for the cardiologist. So the details about the mother moving in are now irrelevant because more than 4 weeks has passed, and we can assume that the mother is no longer there, meaning that this cause of stress has also been removed. Some of the other details could be included as non-essential information. So, for example, the use of a defibrillator after the heart attack, but you would need to include those details provided that you could show that they were secondary details. You wouldn't want the use of the defibrillator to stand out as something really essential information. And that just leaves us with the final section of case notes that we haven't looked at yet, which was medication and treatment. Just have a quick look at that section. And hopefully you agree that all of those 4 points are relevant to the reader. They all cover the medication that the patient is taking and the discharge information about lifestyle changes and being referred for cardiac rehab sessions. Hopefully you agree that all of those points are relevant to the reader. So now we've gone through all of the case notes. What I've done for you is to arrange all of those case notes into a table. And this table is a really handy tool that you can use, and you can use this for any profession, not just for medicine. It can be for any of our OET professions, because this table and the headings in this table will help you to identify the details that you need to include in your letter from any set of case notes that you're looking at. And when using the table, you can use these headings. You can write your case notes or the information you think need to be included into this table while you're practicing, while you're preparing for OET. You might find, as you get familiar with the table, that you add a few more details to it that when you actually come to write the letter, you end up using. And that's fine. It's part of the process of learning how to summarize key details for the reader, and remembering that what you might find important may not be as important to the reader. So it's a great tool for selecting the relevant case notes to include and then using it to plan your letter. If you start to use this during your practice, by the time it comes to your test day, you'll have those headings memorized, and during the 5 minutes reading time, you can use those headings to prompt you to select the information so that when it comes to start writing your letter, you're planned, you've thought everything through, you're good to go. So we had several medicine letters submitted in advance of Writing Week, and we're going to use a number of these to focus on the strengths and weaknesses of the letters against the writing assessment criteria, so that you understand what you need to do, but also what you need to avoid when writing your own letters. So here is the first letter, which was submitted by Ha. Thank you very much for submitting it. And I'm just going to give you 2 minutes to read it. If you haven't seen the case notes before today, or even if you have, I want you to try to put yourself in the reader's shoes and then comment in the chat box to say if you feel well informed by the end of the letter or you are left with some questions. So read through the letter, think about those notes that we have picked out of the case notes to be important. We showed them on the screen in that table. And then let me know in the Facebook chat or the YouTube chat whether you feel well informed by the end of the letter as the cardiologist, or you are left with some questions. I'll just give you 1 more minute. Put yourself in the reader's shoes and think about whether you feel you have all the information you want, whether you're well informed by the end of the letter, or you are left with some questions. Do you think this is a strong response to the case notes, or it's a weak response? There are some problems with it. What do you think? All right, so Kishka said it's pretty good. Rabia is saying it's really good. That's a nice compliment. Issa is saying there is some weaknesses, but Isra saying it's good. Katie also saying it looks good. Chatura, very good. All right. Thanks for the comments. Just going to pick up quickly on this question from Dr. Mirza, who says, do you sign it off with just doctor or your name? You can see on the screen that this letter ended with doctor, and that's absolutely appropriate. That's all that's required for OET. At the end of the letter, you don't need to add your name, just doctor is appropriate. So looking at this letter, I would agree with those of you who said that this was a good letter. I think it's an example of something that's very well written. It's not perfect, but there are a lot of strengths. And as most of you are aiming at a B grade anyway, perfection isn't something you have to worry about. So let's have a look at some more details from this letter. So compared to the writing task, is the reason for writing clearly explained in the first paragraph? So we're going to put a link to the poll question for you to answer. Is the reason for writing clearly explained in the first paragraph? And I'm giving you 3 options for this: yes, partially, or no. So have a look at that first paragraph. Do you think the reason for writing is really clearly explained? And then answer yes, partially, or no. And we can see we've already got people answering mostly yeses. Also coming through on chats, Kishka says yes. Okay, great. Just give another 10 seconds in case some of you are heading to the poll now and you want to answer. Yeah, a few more coming through on chat for yes and partially. So yes does seem to be the most popular response. And what I would say is that the second sentence is a very clear explanation of the task, and it is a nice touch to add cardiac in front of medications to personalize it further to the reader. But the mention of the recent diagnosis of an acute myocardial infarction is misleading. The heart attack was 3 months ago, which in the context of this letter couldn't be considered recent. Okay, so make sure that you don't change the meaning of the case notes. And that's the tip that I have here for purpose, one of the assessment criteria that the assessors use to check your language. Use what is written in the writing task to help you make your introduction paragraph very clear. But be careful not to change the meaning of the case notes when you are constructing your sentences. So including that recent diagnosis, you're changing the meaning, and that would cause confusion for the reader. All right, let's have a look at another question. This one is, what do you think about the opening phrase? Thank you for seeing Ms. Bennett. Do you think this is suitable for this situation? And you can click on the link from the chat now to answer. And for this question, you've got a sliding scale to choose from. Do you think it's an appropriate way to start the letter, or do you not think it's an appropriate way? Or you can slide the scale to somewhere in the middle. So let me know what you think. Is this an appropriate way to start this letter? You can choose from appropriate, not appropriate, or somewhere in the middle. What do you think? Is this a good way to start the letter? Or comment into the chat if you prefer. So we've got some difference of opinion here. On the poll, we're slightly over half towards the appropriate line. In the chats, we've got some and some. Yes, no, yes, it's appropriate. No, it's not good. I'll just give 10 more seconds if you want to answer that question. Do you think "thank you for seeing Ms. Bennett" is an appropriate phrase to start this in this letter? All right, so the end result of the poll is still over halfway towards the appropriate line, but there has been some disagreements between the chat and the poll. So what I would say is this is an appropriate way to start a referral letter. It's one of those options. There are many options. Some of you are saying "I'm writing to refer" would be better. Some of you are saying this isn't particularly formal, but "thank you for seeing" is one of those standard phrases that doctors use. Although, as someone commented in the chat, they haven't yet seen the patient, it's said in a way that assumes they're going to. So you say "thank you for seeing," meaning I'm sending you this patient and I assume you're going to accept them. So it is a natural phrase that doctors definitely use in English. And it is an appropriate way to start a referral letter. But there are many ways to start a letter. And there isn't only one option which will be right for any situation. So please don't feel like there is only one perfect way to start a letter. My tip for this question is that you need to be prepared to be flexible with your language in your letter. So when you're practicing, try out different ways to start and end your letter. And then on test day, you can choose the language which is most suited to the situation you're writing about. Somebody said into chat, you could definitely use the verb request. Absolutely, you could, because as we saw in the writing task, it's requesting advice and a review of the medication. So you could absolutely say "I'm writing to request" to start this letter. As I said, there are many options. There isn't one perfect option, but you need to be prepared to be flexible. So now having a look at paragraph 3, what do you think about how Ha has summarized the events on the 8th of February? Do you think these events have been summarized well or not particularly summarized well? Do you think they've been summarized poorly? So another poll question coming into the chat now for you to answer. Looking at those events which are in paragraph 3 and that are highlighted on the screen, what do you think about the way that events on the 8th of February, which is when the heart attack occurred, have been summarized? Add your thoughts into the poll now. Do you think they've been summarized well, or do you think they've been summarized poorly? What are your thoughts? Early results are coming in at summarized poorly. But that's now changed and we've gone to summarized well. So opinions are still coming through. What do you think? Do you think this has been summarized well or summarized poorly? In chats, we've got poorly from Ali. Rabia is saying it's a good summary which covers everything. Shahzad's also saying it's been summarized well. Isra says, I only disagree with the last sentence. And on the screen, the results are seeming to suggest most people are now in favor of this being a good summary. Great. So yes, I would agree with you that in the main, this has been summarized well. It hasn't included a lot of additional explicit detail about what happened, but just the outcomes using a couple of complex sentences. So we've got information about the heart attack following the flight, the fitting of the stent, the medication and the discharge actions, i.e. the cardiac rehab referral and lifestyle advice. There is a little bit of unnecessary detail included about the stress from having her mother stay, but we know that that's now finished. And there are a couple of minor language mistakes, especially recommended instead of prescribed. But overall, this is done well. So my tip here, and this is for organization and layout, is to remember that you need to organize the case notes into themes or topics for the reader. And this can mean selecting case notes from more than one section and combining them together to create a clear picture for the reader. So overall, I would say this is a strong letter, which from the reader's perspective can be judged by how easy it is to read and retrieve the important facts. Apart from the points already mentioned, there are a couple of other minor language errors, and I would have said that mentioning the exact increase of alcohol units would have been helpful details because that increase has been quite significant. But I would say that Ha can feel quite comfortable that this letter is of test standard and could book her test if she hasn't done so already. So let's have a look at another letter. This one was submitted by Janice. So thank you, Janice, for submitting it for this session. Again, I'm going to give you a couple of minutes to read the letter and then comment in the chat about whether you think this letter successfully explains the reason for writing. So just take a couple of minutes to read through Janice's letter and let me know in the chat on Facebook or YouTube whether you think this letter successfully explains the reason for writing. Just give you one more minute. What do you think in terms of the first paragraph, the reason for writing? How successful do you think this letter has been in making it clear for the reader to understand what's going on? Chatur is saying the introduction is not enough. Syed, the purpose isn't clear. It's not concise, many unnecessary details. Vindya also saying not enough. Mohammed's going a little bit further than that. It's saying it's incomprehensible. Machi, the reason of the letter is not clear enough. So what I would say about this letter is, like the first letter, it was also not explicitly accurate about the reason for writing at the beginning. The ending provides that detail very clearly and accurately, but the suggestion at the start is that the patient's hospitalization was more recent than it actually was. And in the second paragraph, we can see an error about the timeline, which suggests the patient was only discharged 1 month ago, and that she's reluctant to follow the treatment plan rather than she is experiencing side effects from her prescribed medication. And this kind of inaccuracy or change to what is written in the case notes will impact your score for purpose. So be really careful to keep the meaning of the purpose for writing the same as that which is written in the writing task. Have a look now at paragraph 2. And if you were writing a letter for these case notes, I'd like to know whether you would have included all of the details about the patient's heart attack. So we've got another poll question for you to answer here, just coming through into the chat now. If you had written this letter, would you have included all of these details about the patient's heart attack? And you've got some options to choose from, which are yes, no, or not sure. What do you think? We've got no's coming through. No's on the screen and some more no's coming through in the chats as well. Lee is saying too many details. Yeah, it seems that many people are saying no. Mary is saying only the summary of the condition and the most relevant things, but not every minor detail needs to be mentioned. Yeah, I would definitely agree with you, Mary. So what we know from the case history is that Ms. Bennett recovered from her heart attack, and her current problem relates to the side effects from her medication. Therefore, the symptoms she felt before the heart attack, the defibrillator was needed, have since been superseded and could be omitted. The letter is also too long. There's more than 260 words for this letter, so including irrelevant details will impact the score for conciseness and clarity. And this is my tip for this criteria. So while it is tempting to include all the details about a patient's medical event or injury, think about whether this information has any impact on the reader. If the patient has recovered or the current situation is not linked to that prior medical event or injury and has been superseded, it can be omitted from the letter without loss of detail for the reader. So thinking about other things that might have been omitted, I want you to answer this question. Is there any other details you can see in this letter that you would have omitted if you had written the letter? So you can click on the link in the chat now, and you need to type your own answers into the poll this time. So are there any details that you can see in that letter that if you had written it, you would have omitted yourself? Some of you, I think in answer to the last question, have said she expanded too much of the story. There's a lot of irrelevant details. So what are some of those irrelevant details that you could see in the letter that you would have omitted? So someone's saying the technique of the stent. Yeah. Hazem is saying that she was at the airport when the event happened. That's come through in chat. Rabia also in chat saying the small-sized artery led to insertion through the groin. In the poll, less details about the procedure. Mohammed, the name of the hospital. That she was discharged a week later has come through in the poll. Ali saying details of the surgery. Yeah, we've got the hospital name coming through in the poll as well. Mary is saying stent placing details, like from where it was inserted, the traveling detail. Ogun DP is saying the details of what happened at the airport. Great. So yeah, I would agree. So the fact that her arm arteries were too small to insert the stent could definitely have been omitted. The priority obviously is to communicate that the stent was fitted via the groin. Also in paragraph 4, that I'm still concerned that she's still at risk is also not necessary. And my tip for that specifically, again, and for conciseness and clarity, is to remember that you don't need to explain the case notes or your opinion of the situation. The facts are sufficient to show the patient has cardiac risk factors, so you don't need to add your sentence, this example on the screen, to explain that. You're only being asked to communicate the details in the case notes, not explain or justify anything that you are communicating. All right, so we've got one last question about this letter, which is which of these statements about the information to include in the RE line at the start of your letter is correct? So the poll question is coming through to click on in the link in chat now. Which details can you include in the RE line? This one's going to work a little bit differently. We're going to start the question. People are joining now, and then I think if we press enter, it will start the question. So the question options are going to come through now. Which of these statements about the information to include in the RE line is correct? And you have 20 seconds to choose your answer. So do you think it's the patient's full name and date of birth, the patient's full name and age, or the patient's full name and then any other social details you think that are relevant? All right. Most of you were saying the first option, and that was the correct option to choose. So well done if you chose that as the correct answer option. Now, some of you may think to include the age is fine, but what I would say is that the RE in the RE line stands for reference, and this is the way that the reader can identify the patient in the letter. So details such as their name and date of birth could be input into a database and bring up results to find this patient. And official OET case notes will provide the patient's date of birth for you to use here. Now, a tip for this, which comes under genre and style, if you wish to include the patient's age, as Janice did, then you can as part of the introduction. But any other details, including the patient's weight or height, their occupation or marital status, should not be included in the RE line, but within the body of the letter. So the RE line, the reference line, is there for the patient's name and their date of birth only. So overall, the main details from the case notes have been provided fairly accurately and organized into sections that are generally on one topic, and the language is generally appropriately formal too. But the areas that I would recommend Janice work on is selecting which information to omit. The table that I showed you at the start will help with this, and make sure that she starts the letter with a clear explanation of why she is writing. All right, let's move on to a third letter. This one was submitted by Miat. And again, I'm going to give you a couple of minutes to read the letter and then comment on how well the first sentence works to explain the reason for writing. So have a look at the letter that's on the screen now. And just take a couple of minutes to read the whole thing quickly, and then comment on how well you think the first sentence works to explain the reason for writing. What do you think about this letter and this first sentence in particular? How well do you think it communicates to the reader the reason for writing? Abdo saying it mentions it quite well. Rabia that the lawyer part doesn't need to be mentioned, the heart attack isn't mentioned, and there's some errors. Dr. Murphy saying she was referred for a medication review. Mohammed saying a comma is missing. Chatura is saying divorce lawyer isn't necessary. Lee, the purpose is clear, but there are some irrelevant details. Isa, it's partially suitable. Great. Okay. So I would say that the meaning is communicated, although the language used is a little bit clumsy. Noun phrases would have been clearer rather than verb phrases. So who needs a review of her medication and advice about lifestyle modification would have been more accurate, but the reader would get an overall sense of that communication. A couple of you are mentioning that there's no need to mention the occupation of the patient in this case. I would say that the lawyer is important. Lawyers tell us that this person has a stressful job. I know many jobs are stressful these days, but some categories of job are considered more stressful than others, and I think it is a useful detail. We don't need to say she's a commercial lawyer, but a lawyer is quite useful as a small detail to include in the introduction. So looking at the rest of the paragraph and thinking about appropriate writing for healthcare professionals, I'm going to ask you another poll question. Do you think your writing is supposed to be objective or subjective? So this is an easy question to answer in the poll or through the chat. Do you think your writing should be objective or subjective? Thinking about the type of letter that you're writing, who you're writing to. What are your thoughts? Is it supposed to be objective or subjective? So objective would be factual, I suppose, and subjective more opinion-based. That's right. Most of you are coming through with the writing should be objective. Perfect. So that was the point I was hoping that you would agree on. An important part of your letter writing is to use the appropriate genre, which should be formal, professional, and objective. And these sentences, which provide the patient's social history, make connections where none were given in the case notes. So, for example, that the suggestion is that the patient drinks and smokes because she lives alone. That's not said in the case notes, and that is a subjective opinion rather than fact. So my tip here for genre in style is try to present details about the patient's lifestyle choices as factually and neutrally as you can. So avoid terms which can be considered judgmental, such as heavy. Leave it up to the reader to make this conclusion, which they would be able to from the units of measurement that you have provided. Here's another question, thinking about the organization of this letter this time. As a strategy for writing your letter, is it a good strategy to organize your letter in the order of the case notes? And this is another of those questions where you've got a sliding scale. You can choose anywhere between you think it is a good strategy to it not being a good strategy, or somewhere in the middle. Thinking about when you receive a set of case notes, would you organize your letter in the same order as the case notes are written? Or would you say that's not a good strategy? You need to organize the letter somehow differently. So early poll answers are more in favour of it not being a good strategy. Mohammed in chat is also saying no. No from Ediza Linto, not good. All right, so I'll just give you 10 more seconds if you want to answer that poll question. Most people in chat are saying no. Mary is saying it needs to be organised according to the type of case notes, like perhaps from the visits. Sanoba is saying not a good strategy. And the final poll result is much more closely to not a good strategy than towards the other end. That's correct. So it's important to consider the reader's needs when writing your letter. And this means combining notes together into sections on one topic. This letter works through the case notes from start to finish, which is why we have the social history combined with the introduction, and then a paragraph which starts by describing the patient's family history, and that's then combined with events which occurred at the airport on the 8th of February. So my tip here, again, for organisation and layout, is that it's worthwhile spending a few minutes planning before you start writing your letter. If you're taking OET on paper, you can use the blank page on the back of your answer booklet to decide what topic for each of your paragraphs is going to be and which information from the case notes belong in each topic. If you're taking OET on computer, you can type a plan at the top of the text box to refer to while you type your letter, and then delete that plan before you submit your letter. In both test types, you can identify the case notes you think are important by circling or underlining things on paper or highlighting on the computer. And that's a really important tip to make sure you organize your letter appropriately. One last question I've got about this letter. This is, which title can you use for a divorced woman? This is a very frequently asked question that we get for OET. You can vote in the poll now, which is coming up in the link in the chat now, or you can let me know in the chat box on Facebook or YouTube. Which of these titles can you use for a divorced woman? Miss, Ms, or Mrs.? You can choose more than one answer option in the poll. So we've got most people in chat saying Ms, but we've also got a couple of options for Miss and one for Mrs. On the poll question, we've got all of them represented there as well. Miss, Ms, Mrs. Great. So I can see that this is still a cause of confusion for many candidates, and I can completely accept why that this is a cause for confusion, because women are able to choose which of those titles they wish to use, and any of these are possible for a divorced woman or a married woman, although probably Mrs. or Ms. would be most common. But any of them are possible. The main thing is, and the way I can reassure you, my tip here for this question is that official OET case notes will include the title for female patients as well as for female readers who you are addressing the letter to. So make sure you copy the title accurately, as it stands out as an obvious mistake for the assessor, as it does here. So the patient's title that was given in the case notes was Ms., not Mrs. And this candidate has not copied that title correctly. While this mistake by itself won't significantly impact your final score for writing, it would be noted as a mistake as part of genre and style. And given that there's already quite a bit of subjective language in this letter, which would also come under genre and style, the score for this criterion is going to be lowered as a result of those mistakes. So overall, there are some problems with this letter, as I've identified, but the main information about the patient has been communicated. And compared to the previous letter, there weren't so many irrelevant details included about the heart attack. I would say that Miat has some work to do around language accuracy and to work on appropriacy for the formality of healthcare writing. So I've got one final letter to show you in detail, and this one was submitted by Eamon. So thank you to Eamon for submitting that. And again, I'm just going to give you a couple of minutes to read through it and then comment in the chat. This time I'm asking you to focus on the layout of the letter. Do you think the layout at the start with the date, the reference line, the greeting and the address are in an appropriate order for the letter? So have a quick look through the whole letter, and then in the chat, let me know if you think the layout of this letter is appropriate for OET writing. And Mohammed saying it's disorganized layout. Rabia, it's incorrect order. Amel, the layout is not appropriate. Dr. Murphy, that's incorrect. Vivi, I think it's not appropriate. Sanoba, incorrect. That's right. So the order in this letter is quite muddled. Now, there is a degree of flexibility with these details. Right, there we go. You can see that it is possible for the date to be either above or below the address, and for the greeting line to be either above or below the reference line. But on the screen are the options that you could choose from. But the order should be date address first in either order, and then greeting and reference line in either order below that. This is something that will be expected of you in your workplace, so it's good to learn the correct order now. And we've got a great article about layout questions in an OET blog, which is written and we're posting into the chat now. And this is called Layout of an OET Letter. So if this was something that you have a few questions about, where to organize different parts of your letter, have a look at that link after the session, and I think you'll find it really useful. So looking at this letter in a little bit more detail, the topics for this letter are introduction, social family history, heart attack, today's visit, and requests. And I would like to know your opinion on whether this is the order you would use if you wrote this letter. So the order was introduction, social family history, heart attack, today's visit, requests. Is that the order that you would use if you wrote this letter? So the poll question is open now. The link is in the chat, and you can choose from yes, no, or not sure. So is this the order you would write these topics in your letter? What do you think? Yes, no, or not sure? So we've got no's coming through on the screen in the poll. One yes, and also a couple of yeses in the chat and one no. A few more no's coming through in chat now as well. Abdullah saying not sure. Fair enough. Thank you for saying. Just give you 10 more seconds if you want to vote in that poll or to let me know in chat. In chat, it seems most people are saying no, which agrees with the poll on the screen. Great. So thank you for voting. I would agree that you need to prioritize the details about the heart attack rather than the social history. So these details are much more important in terms of what's happened for the patient to be able to understand. So it would have been good to switch the order for those paragraphs to bring the heart attack details in front of the social or family history information. And my tip here for organization and layout is that you need to make decisions about how to organize the information based on what the reader would consider important. So try to imagine you are receiving the letter, and once you understand the reason for writing, which information would you want to know, and then what would help you to better understand the information, and then what would be the next information you want to know, and then the next, and so on and so forth. So think about what the reader would want to know. And one last question about this letter. I'd like you to rate these in order of politeness to the patient. And this is a question I've seen that a few of you have asked in the chat already. So this will help you if you had this question yourself. So in the poll, in the link in the screen, you can order these in order of politeness. So the one that you think is most polite should be at the top. The one that you think is least polite should be at the bottom. You can organize these in order of politeness, thinking about the patient. So not in order of politeness to you. Which one do you think is most polite? That would be the one you put first. The one that you think is least polite is the one that you would put last. So in the poll, you can choose to order those in order of politeness, or let me know in the chat which ones do you think are most polite. So name is coming out in front as most polite. Shazad is saying not sure. Mary is saying name and pronoun, perhaps. Mohammed is saying name, then pronoun, then case, then patient. Roshi, name, then pronoun, then patient, then case. Shadi is saying name is most polite. Dr. Murphy, name, then pronoun, then patient, then case. Abdo, name is most polite. Chatura saying first paragraph name, then he or she. Just give you 10 more seconds if you want to answer that question. Great. So it's really pleasing to see that you were all picking out name as the most polite for the patient. And as a rule, patient and case should be avoided in your letters. While this letter is going to a healthcare colleague, you should imagine that it might at some point be seen by the patient, and you need to make sure it is as polite to them as possible. So try to imagine that referring to them as the patient or this case would seem slightly disrespectful. Now, of course, you might use the patient if you're saying I'm writing to refer my patient. That's slightly different. But if you talk about the patient did this or the case of that, that is considered disrespectful. So try to demonstrate politeness as well as clarity by using the patient's name the first time he or she is mentioned in each paragraph. So in each paragraph, we can see that this letter did it in the first two paragraphs. But even in the third and fourth paragraph, use the patient's name the first time that they're mentioned, and then after that, a pronoun, he or his, or she or her in this case, are completely appropriate. You don't need to start a paragraph with the patient's name, just use their name when they come to mention it in each paragraph. So as an extra tip, because we can see that this candidate has got muddled about the order of names in English, this is perhaps different to how you organize names in your language, but the order that they will be written in official OET case notes are title, then first name, then family name. So for this patient, the patient's title is Ms., her first name is Eleanor, and her family name is Bennett. So in the introduction, it's good to use all three, the title, the first name, and the family name. And then the title and the family name, so in this case, Ms. Bennett, as Eamon did for the first mention in the second paragraph, but also in the other subsequent paragraphs. So overall, Eamon has done a good job of including the relevant case notes accurately and mostly omitting the details that are not relevant. So the main area he needs to work on is his language. The frequency of the errors and typos would cause some strain for the reader, and this reduces the success of the communication. So we are coming towards the end of the session, but I have 6 more letters that I want to just show you very briefly, and each one I'm going to pick out in just over a minute on each letter, a strength or a weakness to give you some final tips for things to do and to avoid. So this letter from Mihaela is another strong letter. Some highlights of the letter are the organization, which has considered which details the reader would find most important. And there are some nice examples of summarization, such as at the beginning of paragraph 4, to succinctly cover the patient's lifestyle and the way the reason for writing was made immediately apparent and then expanded at the end of the letter. A few little but significant details would have improved it in further still, such as removing recent before the heart attack, because as we discussed earlier in the session, the heart attack was actually 3 months ago. But overall, this letter is also a test-ready standard. This letter comes from a candidate who didn't want to share her name, but has covered many of the important details. What I want to pick out from this letter are some unstated additions that were added, and this is something to avoid. And some examples of this are the use of pleasant in the first line. Don't add an adjective like this to describe the patient, even if this would be considered standard in your current practice or place of work. Impartiality is expected in OET writing, so a patient's pleasantness is considered emotive and unnecessary, and it wasn't in the case notes in any case. Another addition is that the patient has had many counselling sessions about her lack of active lifestyle, and this also wasn't said in the case notes. So the tip here is everything you need to communicate is provided for you in the case notes. You don't need to add any additional details. This letter from Chidugu has been well laid out and organised into section. However, it does read a little bit like a story, which can be a mistake a number of candidates fall into. If we look at the second paragraph, we can find a lot of detail about the patient's heart attack, which has been presented in narrative form, including language such as the first aiders responded promptly, 75 minutes later, so-and-so happened. So there is a balance to expanding the case notes into full sentences and adding additional words which turn the events into a narrative. Remember, you are aiming at a letter which is clinical and formal. This letter from Mahmoud is well laid out and uses suitable opening and closing language, but this letter tips the balance in the other direction from the one that we just looked at, which was more like a story. This letter doesn't fully expand the case notes into full sentences. The clearest example of this is paragraph 6, which is written as a single sentence, but should be separated into at least 2 sentences and the details expanded, such as Ms. Bennett is divorced with 2 daughters. Obviously, this candidate had some troubles with the name of the reader and the name of the patient as well, which have got muddled. And this is a high-level thing that you should check as you write out the greeting and reference lines. Double check as you write those lines, have I got the title of the patient and the reader correct as they have been given in the case notes. Layout is another simple factor that you can easily improve to ensure you score highly for this criteria. It's scored under organization and layout. In Vindhya's letter, he has indented the start of each paragraph, which isn't required either on paper or on computer, although I would say you won't be penalized if you do this. I'm just mentioning it as something that you don't need to worry about doing. There's also no requirement to include the patient's address in your letter, even if it's provided in the case notes or the task is to request a home visit to the patient. It's not necessary to include it. And finally, the standard ending for letters, which start with the reader's name, is yours sincerely. Yours faithfully is standard when we don't know the reader's name and we use their job title in the greeting. So, for example, if the writing's task said to write a letter to the cardiologist, we would start Dear Cardiologist, and we would end the letter with yours faithfully. The letter is written, though, in mostly clear and accurate language. And this final letter is correctly laid out in clear sections, but this is a final reminder to be scrupulous about checking you are accurately representing the case notes when you are writing your letter. They are in front of you the whole time, so there's no need to rely on your memory, and you can check them as many times as you like while you're writing. In Ahmed's letter, he has used the wrong title for the reader, which should be doctor, and it's likely to make any doctor grumpy if you don't use the doctor title. So that's really something to learn for your work, not just for OET. Don't use the wrong title. You're likely to make your reader very unhappy. There are a number of other inaccuracies in the letter, though, such as your further assessment and management would be highly appreciated, which wasn't the request as per the task. Remember, we were requesting advice and a review of the patient's medication. So there are a number of other inaccuracies, things like drinks alcohol more than before, how much more, over what period. And another one, over the past 3 months, Mr. Bennett presented with symptoms suggested of heart attack. When was this exactly? 3 months ago, the heart attack occurred. He hasn't been presenting multiple times. So that phrase is inaccurate and it causes confusion. These are all examples of what candidates tend to refer to as template sentences in this, and they're in this letter and stand out for being used inappropriately, such as the one that I have just mentioned. So if you look back through this session and the feedback that I was given, you'll notice that there were a couple of letters that I said were very strong examples and that were test ready. So you can look at those as guidance of more things that you should do. And there are then weaker samples that I've picked out some problems with that you could see are not yet at the required standard for this letter. So that brings us to the end of the session. If you are a doctor watching, I'd like you to answer one last poll question for me, and that's to let me know if you feel you've learned some useful tips to improve your writing from looking at these samples. You can choose from yes, no, or not sure for that poll question, or let me know in the chat. And while you're answering that question, we're also going to pop into the chat the link to the sample letter, the official sample letter for these case notes, so you can compare it with your own. These case notes and this sample letter will also be available on the OET website from next week. But for now, you can download your own version of the official sample letter to have a look at and compare with your own writing. So great to see many of you have found the session useful. Resounding yes in both the poll and on the chat. So that's great to see. Thank you so much for listening. I've got a couple of final tips to give you just before we finish. And that's to let you know that, as I said, the medicine case notes and sample letter will be available next week on the OET website. But in the meantime, if you're looking for more writing resources, make sure you've bookmarked as a favorite or downloaded the OET writing guide, which has just come up into the chat now. And the other thing that we're adding a link to, which you can see on the screen, are the assessment criteria that the assessors use to score your writing. And you'll notice that during the session, I was naming these criteria with my tips. So I was letting you know tips specific to the different assessment criteria that the assessors are using. So make sure you also bookmark or download the assessment criteria for a ready reference to make sure you are scoring as high as possible in those different areas. So if you haven't already tried writing a letter for these case notes, you've now got the case notes, you can have a go. And I would suggest writing your own letter before you look at the sample letter. Consider making use of the table that we looked at earlier on in the session, because this will help you to correctly select the details you need to include, as well as helping you decide which details to omit. So thank you very much for joining me today. You're welcome to join me in any of the other Writing Week sessions coming up later in the week. And if you're not a doctor, but you are joining anyway as a nurse, I'll look forward to seeing you tomorrow. And our other OET professions will be on later in the week, Thursday and Friday. So thank you. I might see you again soon, but thank you for joining me. Bye for now.